What's going on, guys? It's Dr. Kellen. I'm coming to you live from Fit Club Chelsea here in New York City. Today, what I want to speak to you guys about is shoulder instability. How many of you have suffered from a dislocated shoulder? How many of you have instability at the shoulder? It may pop out while sleeping, while reaching for items, pulling open doors. There's tons of people who are suffering from this pain, and today I want to cover that for you guys. Essentially, your shoulder is one of the joints in the body with the largest range of motion. You should be able to reach overhead in multiple directions: internal, external rotation, adduction, abduction. A lot of fancy words, but essentially your shoulder needs to be very mobile. At the same time, you also need structures there to make sure that it's not too mobile and is an unstable joint. Some of those structures include the rotator cuff, which is a group of 4 different muscles that really help keep your shoulder aligned where it's supposed to be, as well as your labrum, which is a soft tissue structure that circles around the shoulder joint that also helps to keep the shoulder aligned and in access to where it's supposed to be. So, how does shoulder instability happen? It can happen traumatically. Typically that would, someone who falls on an outstretched arm. A lot of times, especially here in the city, when it's slippery outside, patients, slip down the stairs, they reach up for a banister, and then they yank their arm and they have a dislocation moment or a subluxation moment at the shoulder. And that's how a lot of these injuries actually happen. Also lifting, think about Olympic lifting, you're getting into your snatch position. Sometimes people are doing that exercise with too much weight and too forcefully, and their shoulder goes too far back or extends too far back over the head, and that puts your anterior shoulder at risk for some instability. So those are some of the reasons why you may have an unstable joint. Swimmers in particular just need a lot of mobility in their shoulders for their sport, and they suffer from a lot of shoulder instability. Pitchers are some of the other athletes as well as quarterbacks. So tons of people suffer from shoulder instability, and here's why. A lot of people are not addressing the smaller muscles that live in your shoulder. What we're doing is we're doing a lot of pressing and pulling for our bigger muscles. Those muscles are our prime movers. Muscles like your pecs, muscles like your deltoid, muscles like your lats. We work those out very frequently, but oftentimes we overlook these smaller muscles like the rotator cuff. Those are 4 different muscles that we need to be training to help improve the stability of the shoulder. So today, what I'm going to do is I'm going to show you guys my top 3 shoulder exercises for anyone who's suffering with shoulder instability. Let's check them out. The first one is going to be Y's, and we're going to perform those on the Swiss ball. So we have our Swiss ball here. Just going to allow myself to get in a position. I have the ball over the abdomen, and what I'm going to do is, while I'm in this position, I start by first squeezing my core, squeezing my glutes so I have a nice stable base. What I'm going to do here is I'm going to lift my arms up into a big Y, and then drop down. Allow the arms to come up into a big Y, and drop down. Hold at the top for about a second, and then you're going to allow these arms to come down. Here we're really training some of the muscles in our middle and lower trap, helping keep some stability, not just at the actual shoulder joint, but also at your shoulder blade, which is very important for us as well. That's exercise number 1. All right, guys, exercise number 2, we're going to need the assistance of a kettlebell here. What we're going to do is we're going to do some butt up kettlebell holds, okay? So I have 26-pound kettlebell. Obviously, depending on where you are in rehab, you're going to be probably a little less weight. If you're getting back to return to sport, you might be a little heavier, depending on what your sport is. I'm going to start by dropping into a kneeling position. Say my right arm is my unstable arm, and I just want to hold here. Typically, I put a timer up, 30 seconds, just really trying to hold in this position. As I'm here, not only working my shoulder, I'm also working the muscles in my core as well, and I'm also engaging my glutes here, right? So I'm working a lot of muscles together, which is very similar to sports and athletics. So in this position, we can also rotate out, rotate back in, adding a little movement challenge to the shoulder as well. That's a little bit more advanced, but that would be my second exercise that I love for anyone who's suffering with shoulder instability. All right, guys, so for the third exercise, as part of my top 3 exercises for anyone with shoulder instability, we're actually gonna get into and onto the floor here. We're gonna put our arms in a weight-bearing position. So, we're gonna assume the top of a push-up position. Again, very important. Back isn't sinking towards the floor. Hips aren't pressed up into the air. What we wanna do is we wanna be nice and neutral here. And in this position, what I'm going to do is I'm going to go, and I'm gonna face you guys. We're gonna go shoulder taps with a hold. So typically people are doing these super fast. What we wanna do is keep the legs nice and spread. We're gonna tap, hold, 5, 4, 3, 2, 1, switch. 5, 4, 3, 2, 1, switch. While doing this, what's key is that when you rotate, you're not rotating your hips towards the side, you're keeping your hips firmly facing towards the floor. We're gonna go 5 seconds on one side, 5 seconds on the other side. It's a big challenge on the shoulders, also on the core. You'll feel a nice little burn here. But when we talk stability, again, when I hear the word stable, I think core first, and then I start to think outward, right? We can't have a stable shoulder without a stable core. So it's very important that we train them both simultaneously. All right, guys, if you like this video, you love this content, make sure you subscribe, like the video, drop a comment below. Any injuries or anything that you would like to see us cover, really appreciate your feedback. Thank you, and until next time, peace.